name is James Frimpong, a certified OBGYN working with Goshen OB physicians. I went to medical school in Ghana and then graduated and migrated to the United States and did my OBGYN residency program. I do general obstetrics and gynecology. And I also see some high-risk patients like diabetic patients, high blood pressure patients. I see patients all from ages from 15 and upwards till 16 and upwards. And I don't have any cutoff for in terms of the BMI. My specific interest within the specialty is minimally invasive procedures. So I do traditional laparoscopy, robotic laparoscopy surgery. I hardly open to do surgeries now. I also do placement of mid-urethral sling placement for patients that have stress incontinence, for patients that come with unexplained abnormal uterine bleeding. I would say get an ultrasound. So by the time the patient gets to us, ultrasound is done so we can evaluate that patient. If you can get the thyroid function test, which is also very, very important. For obstetrics, when you get a patient that's early pregnancy and the patient is diabetic, type 1 or type 2 diabetes, right? You want to refer that patient to an OBGYN. And also, if you see a patient who has had a previous fetal loss in the second trimester, and you think that she has cervical incompetence or cervical insufficiency, I would suggest that you refer that patient to the OBGYN because it's time sensitive. You can do a cerclage. A cerclage is just putting the stitches over the cervix, and so that the fetal loss will not happen again. So you go around and stitch and tie it, and you tie it at the top. So at the end of the pregnancy, when the patient is 36 weeks, then you remove that stitch, and then the spontaneous labor may begin. The cerclage has to be placed at a particular time between 12 and 14 weeks. I'm the only one that does this cerclage in my group at the moment. It's something that can save the baby and can also help the mother if it's referred earlier.